Now, we are going to hear from some experts who truly take the whole person approach to diabetes care. We're going to be talking to professionals in health coaching, nutrition, and physical activity about more ways to help people with diabetes make meaningful lifestyle change. This panel is going to be hosted by our own faculty here in physical therapy, Dr. Joanne Katz. Dr. Katz's research interests include neurodevelopmental issues in infants and the pathomechanics of gait, and her clinical specialties include the assessment of motor control problems in infants and young children and treatment of children with cerebral palsy. Dr. Katz herself adopted a whole food plant-based diet to help protect herself against heart disease, which is prevalent in her family, and she spreads the news about the power of plant-based nutrition in lectures and presentations to students and faculty at Downstate. Joanne is going to be joined today by dietitian Yandra Doring, health coach Krisann Polito-Moller, diabetes educator and nurse practitioner Lucille Hughes, and Dr. Melissa Lee, who directs a lifestyle medicine clinic at Kings County Hospital across the street. So I would like to invite everybody to come on up here, and we can get some more advice.
This session is a little different than the session that we had this morning. Each one of our panelists, who are experts in their own areas, I'm going to let each one of them introduce themselves to you. Then I'm going to ask each of our panelists a question, and they can expand on it for, for quite some time, each one of them. And when we get done, we may do more questions, or if we're getting towards the end, then we're going to open it up to audience questions. And this time, we only have one microphone on that side. So if anybody's over here, you'll just need to walk around to get to that microphone, just to let you know. Okay, so my panelists, if each one of you you were introduced by Beth, but just to give a little bit more background of where you're from and what type of work that you do.
Hi, everyone. My name is Yandra Doring. I'm a registered dietitian, plant-based registered dietitian. I work at Kings County with the lifestyle medicine program. So I have been working for 10 years in the community nutrition area here in New York City. I have consulted for the Department of Health, worked for nonprofits, and now I'm super happy to be part of this amazing expansion of bringing more health and wellness through like the 6 pillars of health. So thank you for having me today.
Hi, I'm Krisann Polito-Moller. I'm the Director of Health Coaching Services for New York City Health and Hospitals. I work with Dr. McMacken in central office. I'm also the health coach at Bellevue Hospital and started the program with Dr. McMacken in 2019. Yandra is my colleague, and so is Melissa. And we're building such an amazing team. We're really excited on the future of our program. I'm also a certified personal trainer, certified group exercise instructor, a yoga therapist, and a bunch of other things. So I'm really excited to be here. I'm really hoping that we can bring lots of everyday tips for everybody to use.
Okay. Hi, everyone. My name is Melissa Lee. I'm trained as an internist pediatrician, and I'm a primary care doctor at Kings County and also oversee the lifestyle medicine program. My other hat is as program director for the primary care internal medicine residency program, so I have lots of very eager learners who love to learn about different ways they can take care of patients other than prescriptions. So thanks, Beth, for inviting me to be part of this today. I guess my fact is that I also am a chronic marathoner, and so I will talk about exercise today, mostly from my own experience and that of some of our patients and from our staff.
Wonderful. Good afternoon. I was going to say good morning. I am Lucille Hughes. I am the Assistant Vice President for Diabetes Education and Program Design for Catholic Health. In November 2022, we had launched our Center for Functional Medicine and Optimal Health, and I'm so thrilled that I've been involved since day one in launching that program. I am a nurse by profession, but certified in diabetes education for 35 years. So I'm thrilled to be here today and to share our experiences with you.
Okay, thank you. Thank you, panelists. So we'll start on this side and just work our way down with everybody and ask you the questions. So we'll start first with Yandra. If you could address the role of exercise as part, I'm sorry, wrong question. Can you address the culturally based aspect of dealing with plant-based nutrition and diabetes?
Yeah, so well, for us in our lifestyle medicine program, that's something that is very important to be able to provide care that is very comprehensive and addresses like all the cultural the cultural aspects that we see here in New York City. We're a very diverse. We live in a very diverse environment, right? So everywhere you go, you're going to see people from all over the world. So in our program, something that we have been doing for lifestyle medicine is taking this into consideration, not only in the nutrition aspect, but with the 6 pillars of health. So regarding nutrition, something that it's very important for us is to be very aware of the culturally dietary patterns of our patients, and also the cultural perceptions of food, right? So when a patient comes to me or any of the dietitians of the lifestyle medicine program, so the first thing that we do is we ask a lot of questions, right? Curiosity is the best tool that you can use as a practitioner, right? So this is something that Dr. McMacken was mentioning, like you get to know your patients, get to know your community, right? Because sometimes you can give the best recommendations for them, especially with our patients living with diabetes, but they will tell you straight to your face, that's not my food, you know? So you really need to understand, and if you don't know and you're not familiar, get a book, talk to them, ask them questions like, what are your favorite foods? Okay, so how can we modify this in a way that makes sense, that you are going to be able to integrate more plant-based elements into your plate, right? So the other thing is to tailor every time that you see a patient in an individual way. Like I can have 2 patients from the same cultural background, but they might have different tastes, right? So they might not like the same food. So I have to take that into consideration when I am counseling my patients. Another thing that you can do is every single culture at least has 2 or 3 different plant-based dishes. So we can start from there, right? As some of our doctors that were speaking earlier, we can start maybe with breakfast, right? So a little modification there, right? So just giving a little adjustment. We don't want them to change their diet from like entirely. So we want to take them in a very steady and very slow change so they can create something that is more sustainable for them. So other things that we can take into consideration is provide the appropriate resources, right? Be prepared with recipes, be prepared with like materials that they're culturally appropriate for them, right? So, and also help them to address any barriers that they might be out there, right? So a lot of times, like these little changes might be easy for me or for some of you, but for patients, this might be like changes that they're like, you know what, I don't know how I feel about changing this about my diet, so how can we negotiate, right? So, and also introducing them to any kind of resources that you think that might be something that they might be willing to experiment, like maybe a new ingredient, right? So what about instead of like using, I don't know, like ground beef, we can use maybe some tempeh or things like that, right? So it might be a challenge for some of them, or some of them might be like, oh, I have never heard of that before. So the way that we approach this is, at least in our program, is just very slowly, right? So we're not going to go for the tempeh at the first time that we meet the patient. So, but we might be just starting with some recommendations, and maybe after like our 3rd visit, they're like, you know what? I know that you mentioned that weird food that I have never heard about. Right? So can you give me a recipe? Like you say something about tempeh bacon, so I'm more like, okay, so I was a success with these other recipes, so I'm prepared to start making these changes. So I think that by addressing like this, like these things that can be challenges, it can be something that, or it might be easy for our patients. So, but also by addressing this, so we are going to be able to give more cultural competent care to them. So, which is what we want to do. Thank you.
Yandra, do you want to tell everybody how the group helps and culturally in the Spanish group that we have?
Oh, yeah. So this has been something that we are launching, so in collaboration with the Bellevue team. So, but like the Bellevue team has developed like this amazing curriculum that is 14 weeks that they take, what we take the patients through like the 6 pillars of health. And we have discovered that depending on like your cultural background, right? So patients might be more chatty. They might be more willing to like say more things. Some patients might be like a little bit more quiet because that's part of the culture, right? So sometimes people just need to express and tell you, hey, I know this, you know, so let me tell people, let me be proud of my cultural background. So it's something that it has been very enriching a lot, our program.
Yeah, I find when I'm looking for specific recipes that are from different cultural backgrounds, there's a lot of good, plant-based cookbooks out there, like Robin Robertson. She has recipes from all different cultures, or like I'm Italian, so I go to by Chloe, and I just modify that because there's a little too much oil in it, but still, you can find them cookbooks that will have the plant-based recipes that seem familiar to them, and like you said, use the tempeh instead of chopped meat.
Yeah, sometimes it's just about telling them, like, what about adding your spices to this plant-based protein, or to this vegetable? And they will be like, oh, I never thought about that, So, but usually our patients are very willing to experiment. So, because something that I want to remind you, at least at health and hospitals, we accept everyone, right? So we work with everyone. So our program is not like an elite kind of program. We take people who might be never able to afford to come to a program like that, right? So, and something that it has been very like gratifying, at least for our team at King's and probably Bellevue, is that the patients really, really appreciate that we take the time and we're teaching them all these skills. So, and they are like, you know what, like, I really want to embrace this. I know that this, maybe in another time of my life, I would not have done this. But something that I love that when I work with my patients, with our patients, and our health coach can corroborate this. So sometimes we ask them, like, what kind of advice would you give to your younger self, right now? And they were like, I will eat more vegetables, definitely. I will sleep more. I will be better connection. I will have better connections, So it's something that it's just really wonderful how can lifestyle medicine really, really help people from diverse backgrounds.
Thank you very much. Okay, we're going to move on to one of the other another pillar of lifestyle medicine with Krisann. If you could address sleep hygiene for individuals with diabetes and provide strategies for patients to change their lifestyle behaviors.
Yes, thank you. Thank you, Yandra, too. Sleep is one of those pillars that we don't really take seriously, right? Culturally, we're like, work more. I can hustle. I can get more done if I don't sleep. I'm really productive at 1 a.m. in the morning, right? We hear this a lot. And when we start to really break down a patient's why is it important for you to be in this program? What has brought you here? What matters to you? And it goes beyond lab numbers a lot of times. It's, I want to spend more time with my grandchildren. I want to be able to walk to the park with my family. I want to go to the social celebrations that I can't get to because I physically can't walk through that door. It's not accessible for me. So when we really connect to why they're here, we start to put those little actions that Yandra was talking about, and we connect it to that why and to whatever disease they're looking at. So for instance, diabetes, sleep is so crucially important to diabetes, but it's really crucially important for behavior change. If you're not sleeping, you're not getting up early to take that morning walk, right? Or we're not grabbing the meal prep that we really didn't have time to do the night before because I got to bed late and now I'm late for work and I don't have time, right? Once we start to get some sleep going for our patients, all of a sudden they have a little more energy, right? They feel better. they're like, oh, this must be working. Oh, you know what? I think I can stop watching TV a little before I go to bed and make that breakfast, right? So really connecting it with why they're there and what's important to them. Sometimes putting like pictures of their family members that they want to do things with on their closet door, their bathroom mirror, or their refrigerator to really keep those little actions really relative to them. And I like to explain sleep to a lot of patients like landing a plane, right? During the day, we have this really busy day. The plane's flying around 30,000 feet, right? When we're ready to land that plane, we don't just drop it, right, and land, right? We slowly start to descend. And we talk about that a lot. What's going on for you from when you get home to bedtime? Are you creating a calm atmosphere? Are you living in a calm atmosphere? Maybe you're not. How can you start to land your plane? What does that mean to you? What brings joy to your life? What brings comfort to you? And we start to look at, we're already reducing our stress then. We're reducing our daytime fatigue. Like Dr. McMacken said before, we're asking them about liquids. Are you stopping liquids and food about 2 hours before you go to bed? And people are sleeping through the night and feel fantastic, right? Are you sleeping consistently? What's happening? Are you waking up at 3 o'clock in the morning and trying to figure out all that stuff that went on yesterday or is going to happen the next day? Can we use some tools like expressive writing? Expressive writing is when for 20 minutes a day or twice a day, usually in the morning at night, you just kind of brain dump. You just start writing what's on your mind, and instead of your brain trying to hold it here so you don't forget, right, it's on that paper. I know it's on that paper. I can kind of let it go for a little while. We usually ask them to rip it up. It's not there to kind of analyze, it's to just kind of let it go, right? Let it go. And continually do that, even if you're writing the same thing. It really gives your brain that time to wind down, your nervous system to wind down. We also talk about exercise. When are you exercising? If you're exercising really close to bedtime, is that causing you for your body to go, hey, I've got some energy now, let's stay up, this is really fun. What are we going to do today, right? Let's extend this day. Or how about if you're watching something that's really exciting on TV, or you're reading a really good book. All of a sudden, 4 or 5 hours have passed, and it's 2 o'clock in the morning, and you intended to go to sleep. So these are all little things that we do on an everyday basis that we really don't look at in the context of our why. So we really help patients really connect that and look at which ones they feel is achievable. What's one of those that you feel would really move the needle for you? Because our patients are the expert. They know their life. They know what's going on day to day. They know their everyday stresses. They know how they feel, and they will give you the answers. They will show you where they want you to lead them, right? So it's super important. I think all of my colleagues would say really listening to our patients and helping them and supporting them on that walk. So if it's sleep health, right? If it's recognizing their daily habits on how that affects their sleep and how that affects their diabetes, on how they're eating, how that affects, are you eating really close to bedtime? That's a really big confounding factor. Now I have energy, right? Or I've had a lot of water, because I haven't really had a lot of water all day, so I'm gonna drink it now. Well, then I'm up 5 times during the night, right? That's happened to all of us at one point or another, and how that affects how they feel. We saw when we were looking at the guidelines on sleep, how waking up so many times affect us, right? We saw how it changes our mood. Sleep is really one of those, like, those nets of all those pillars. It holds up all the other pillars. It's really amazing how just these little tweaks can really start to give patients self-efficacy. They think, wow, I think I can do this, right? We give them those little windows that they can really feel they have a lot of self-efficacy, meaning they have confidence that what I'm doing is really going to help me, that I'm trusting you to give me the information, that I'm not going to be too overwhelmed, but I can actually move the needle on my disease. So sleep is super important for diabetes management.
I have a follow-up question on that. How do you counsel parents of very young children? Because, it's so hard sometimes to get them to go to sleep at night, and, you got to rock them to sleep, and then maybe they wake up during the night. And, I'm talking about working parents.
Oh, yeah.
So they're doing, and working parents of young children.
Oh, definitely. Really, we have to ask them, what is your reality? What is your day like? Take me, when you wake up, what happens? And really look at where they think they can get some time. They may say, you know what, I don't think I can get any more sleep, but at lunchtime, I think I have 20 minutes where maybe I could do a meditation. Or I really think I need some time with my friends to let some steam off, so when I go to bed, I can go to sleep. Like, people, we have to trust our patients, because they do know. They do know. They just need that person to stand next to them and help guide them and really steer them in the direction that they're going in. Yeah.
Yeah, thanks, because as I was listening to you, I was thinking about my kids with their very small children.
Yeah.
And that's true for all of us who have small kids, or anybody with young children. It's like the parents are perpetually
Oh, they
sleep
are.
deprived.
Yes, they
Yeah.
are.
Okay, so now we move on to Dr. Lee. And this morning we heard a good deal about the role of exercise as part of the whole person approach to living. But Dr. Lee, if you can give us some, additional information talking about, what you would say to patients in your practice, and how you would consult with those, health coaches or PTs or exercise specialists that you might work with, who work with your patients.
Sure, absolutely. Thank you for not asking the question about sleep, because when we did that exercise before, that's the one that I went down on before they even finished the sleep thing. And if you ask about living with older children too, the answer is you just go to bed before them, because you can't outlast.
No,
I don't know if there are
that's-
any parents of teenagers in this room,
Yes.
but I've given up. I asked them
They
to close
stay
the
up.
lights and put the milk away, but that's pretty much it.
Right. Teenagers stay up late and they want to wake up late.
Yes, exactly. So I was getting ready for this, and I was all psyched because I was reading about exercise and diabetes, and I was thinking about exercise reducing insulin resistance and increasing muscle glucose uptake. And I was sitting here this morning, and I thought, oh my gosh, everyone's covering all of this already. I'll tell you my personal story with this is rather recent. Our residents were doing a project about continuous glucose monitoring, because we realized that this is more and more available to patients, but we're not prescribing it a whole lot. And let's put prior authorizations aside. And so we obtained some and wore them for 10 days, because the idea is, if you try this yourself, then what will that help enhance the way you can talk about the experience to your patients? And so I wore mine last week, and I wore it on my run to work, and I got to our clinic, and I think I told Yandra and the rest of our amazing team, that's shout out to them over here, that my blood sugar actually went up to 190 while I was was running, and I was like, running is putting me into this hyperglycemic state. And so, I was thinking about how complex it must be if you actually, I was doing this as a QI project. If I were living with diabetes and trying to figure out, do I eat before? What do I eat? How am I doing now in the middle of my run to Brooklyn? I mean, think about how hard that is. And so it gave me some pause. And I think that, there's literature out there that shows that intensive lifestyle interventions work. There's a question, are the supervised exercise programs versus unsupervised exercise programs? And so how do we manage that? Because the patients who we take care of, and I think Yandra and Krisann alluded to this, our Kings County patients take care of everybody regardless of their ability to pay. So that means sitting down and talking to somebody about hey, well, how about, you need to do resistance twice a week, right, with some time in between, and go to the gym, or why don't you, get on the treadmill? That's not accessible to all of our patients. So what do we do at Kings County? So I want to talk about a couple things. One is how do we realize that many of our employees are our patients. We're all patients. That was brought up this morning. So what are we doing for employees when we talk to them about exercise? Because if you're talking about sleep, then when you give what time did you say you got up this morning? 3:30 to get your 9 miles in? Okay, all right. So, how does that work? If you subtract 7 hours, you're going to bed pretty early to make sure you got your sleep too. And so how do I talk to folks who I work with who have young children at home? And so we've tried to do different things, how do you integrate this into your workplace? So we're not so sophisticated as to have treadmills at our desks yet, but we are trying to, have a day a week where we go outside and we walk on the Wingate Park track when it's nicer out. We also have a whole campaign, if anybody goes across the street to Kings County, to take the stairs. And I'm so excited about this campaign because this is really where you partner with primary care and your Office of Public Relations. They made these great signs that are up there that encourage people, one flight at a time, keep on going, you can do this. And so more and more of our team, most of us live on the 7th floor, and more and more people I see are doing it. And we take time to chat in between, a few flights. But those are the sorts of initiatives that we've been trying to put into action. We also, having things that your patients can take part in that are accessible, such as a gym. I think that's a luxury that we have at Kings County. So we actually have a free gym for our patients, and our employees can also work out there as well. And it's during working hours, 7 a.m. to 6 p.m. But that's been wonderful to be able to talk about exercise where we have a trainer who can teach people. Because I was saying, I think I've aged into becoming a geriatrician somewhat in my 10 years at Kings County. And so, some of my patients look at me and they're like, Dr. Lee, an elliptical machine? What are you talking about? And so to be able to say, we have somebody here who can teach you how to use this so that you're comfortable and then you can come in on your own. And there's always supervision there. And that's right down the hall from our lifestyle medicine program. We're also trying to really move our primary care providers to do something that was mentioned this morning as one of the, for exercise pillars, is to do that fit prescription for exercise. So when you're in the primary care office, yes, we have 20 minutes. There's always, we're agenda setting and trying to do some MI. And so how do you make sure that you're also screening people for their fitness, for their exercise activity, and saying that this is just as important, if not more important, than some of those other things that we're putting on the plate right now. So we, in conjunction with the Geriatric Workforce Enhancement Program here, so Dr. Reinhardt's GWIP project, have been giving out resistance bands to our older adults when they're in the primary care practice. And we had our team film a video, so we have seated exercises because we were worried, what are you worried about your patients, right? Falls, making sure that people we printed out instructions just in case people don't like to use their phones. Some people prefer the videos. And I had a patient who came in yesterday, and she was wonderful. She said, look what I carry with me. And she opened her purse and pulled out her resistance band and said, whenever, she's a home health aide, many of our patients work in people's homes, and she said, when my patient's asleep, I bring this out, and this is what I do. And so these are the ways that we're trying to integrate exercise and physical activity into the lives of our patients, of our staff, and really try to improve things. Aerobic is important, obviously. We talked about this morning. Resistance is important. Also, flexibility and balance, especially in our older adults. Because if we can prevent one fall, then we've done a good job that day. The last thing I'll say is building community and relationships. We've heard about that as part of our lifestyle medicine pillars. And so one thing we do with our residency, we do some volunteer work. So we spend time volunteering with God's Love We Deliver. If you're familiar, I've seen them in Brooklyn a lot recently. And so to really get our residents to understand what it takes to make these thousands and thousands of meals, to serve them to medically necessary meals for New Yorkers every day. And so a number of our residents actually joined us not only to volunteer in the kitchen, but also to signed up for one of their fundraising runs. And so I got a bunch of my residents out running, and one of them actually set a goal of SMART goal. I thought it was a little longer than a SMART goal, but he did it. His SMART goal was going from the 4-miler in November to the Brooklyn half that was just a couple weeks ago, and I was volunteering at the water station at 6 miles, and I heard, Dr. Lee, and there he was doing it. So there's so many ways that we can engage people in community and in physical activity, and those are just a few of the things that we've been doing at Kings County. Thanks.
That's great, thank you. And then our final panelist, Dr. Hughes. Can you please speak about diabetic technology and how it can reinforce lifestyle plant-based nutrition?
Sure, love to. I've been dying to. I'm going to, at the risk of sounding a little bit like a dinosaur, work with me here. 39 years as a nurse. So what does that mean? That means that I was on a medical unit when the first blood glucose meter arrived at a hospital. Okay? So in other words, I was using urine testing for our patients living with diabetes. And pre-diabetes, back then, and up until unfortunately recently, was still called borderline diabetes, which the words alone, very much into language, the words alone promoted no change. Because if you think about adults, they're not going to put themselves on the wrong side of the fence, right? You're borderline. Oh, that means I'm still, no, you've arrived. It's a real thing. It's like being a little bit pregnant, okay? So those were the days where I started out. So looking at urine and the first blood glucose meter to now go into the present, having continuous glucose monitoring. But unfortunately, still only a few can afford it, right? Covered under their insurance. So what I'm really proud of is a Catholic Health in our program, we have professional versions of the models that are on the market today. So regardless of the patient's ability to pay, we've purchased them. So individuals with pre-diabetes, we put a glucose monitor on them. Patients with diabetes that don't have their own personal, we put a glucose monitor on them. Because adults don't like to be told what to do. So the day's coming back, well, tell me about your meal plan. Well, I would suggest that maybe we don't eat. It's so powerful. It empowers the person. If they look at it and they see in color what's happening to them during the day, right? Same thing with pre-diabetes. We have reversed and prevented type 2 diabetes by simply putting a continuous glucose monitor on an individual and letting them see the impact of their life, them as a whole person. They think we're putting it on to monitor their food. Oh, you're going to see everything I'm eating. That's one aspect, but of course, it always comes to mind as the number one most important, right? But we need to look at the whole person. So I tell them, no, it's about your food. And they always say, you want to see what I'm eating. And I always add eating and drinking, because many people, we see these spikes after breakfast, and I'm saying, so tell me about what's going on at breakfast. And they'll say, no, I ate this, and it'll sound beautiful. And I'll say, well, did you drink anything? Oh, well, I had like a glass or two of orange juice, because they don't understand drinking and eating are two different things. They're the same. They're going to impact blood sugars. Also being mindful, if you noticed, of how I approach that patient. When we look at the continuous glucose monitoring report, many of us that are used to using these reports and that are really feel that they're so valuable, we may make the mistake of saying that we find that one that has the least amount of variations, because that causes complications down the road. So you want to look at the least amount of variations. And we used to say, myself included, well, this is your best day. Tell me about this day. We don't use those terminology anymore, that language, because that best day, what appears to be the best day, could have been your patient's worst day. And that happened when the patient said to me, oh, I didn't have any money for food that day. I was using whatever I had in the house, because they had food insecurities. So how did I make them feel when I said that was your best day? It wasn't their best day. That was their worst day of the week. So we're very mindful to say, tell me about this. Tell me the story behind what I'm seeing here, this picture. And when we talk about sleep, and again, how people don't understand or appreciate the importance of it, I'll say, okay, tell me what happened in the middle of the night here. I see that your blood sugar went up. We have some variations here. And they'll say, well, I had to get up to go to the bathroom. And I'll look and say, as far as I know, in my 35 years in this field, that does not cause elevation in blood sugar. Oh, but I also had a snack. Okay, so you have to pass through the kitchen to get to the bathroom. No, the bathroom's on the downstairs, and my bedroom's on the upstairs. So you purposely went downstairs to get that snack before returning to bed. So, we try to make it enjoyable. We don't judge patients, but you want to get them to open up, and then they laugh and they feel comfortable and they have a rapport, and then they're going to tell us a lot of other things. But we also look at physical activity during the day. Well, look at here, what happened after dinner. But, oh, you went for a walk after dinner. You used one of the tools that we suggested, and look how you brought that blood sugar down. So they're not making judgments about themselves. They're saying, oh, I had this, but look, I offset it by doing that walk or that jog or whatever. And now they feel empowered. And one last thing. I have found a strategy to using continuous glucose monitoring that I feel really helps empower the patient. When we look at patients with prediabetes or diabetes, unfortunately, in traditional medicine, they're expecting to get yelled at when they go to the provider. Your A1C is up, your A1C hasn't changed, your weight hasn't changed, and they're conditioned to that. So what I like to do, and I work with 16 other certified diabetes care and education specialists, what we like to do is we split that either 10-day or 14-day, depending on what monitor they're using, and we split it down and we bring them halfway through. So we put it on them, and they come back either 5 days later or 7 days later, and we identify trends and patterns. We identify what are they eating. Tell me about your physical activity. Tell me about your sleep. Tell me about your stress. Stress raises blood sugar faster than any food you can put in your mouth. So we say, tell us about that. Let's look at these trends and patterns. Let's pick one thing to work on. Now they come back before we take this off, because remember, it's the professional version. They don't get to keep it. So now they come back, but the wonderful way of doing it, modeling it that way, is they come back and now have the opportunity to see their impact. And now we get to pat them on the back. More importantly, they get to pat themselves on the back. I say, look at this. Well, and when you're used to looking at an AGP profile of the CGM, which shows you like red, yellow, and green, you want less red, more green. To keep it very simple, very colorful, very easy for the patient. Look at this, more green, less red. Look what you've done. You've improved this. And you can see them automatically sitting up better. They're proud of themselves. And they want to go back and do more now. Now they leave, oh yeah, Lou, wait until you see me next time. Wait until you see my They become competitive with themselves. So using this technology truly empowers the whole person, not just food, but every aspect of what they're doing. And of course, integrating and replacing that traditional processed food with plant-based. Once they see it, they're like, oh, do you have maybe I'll do it for 2 meals this week. Then eventually it becomes their lifestyle. So thank you for letting me share.
That was wonderful. Thank you. The way you empower folks to, they have such wonderful feedback from the unit to see how a walk or a midnight snack is how it changes things up for them. So before we move on to the audience being able to ask questions of this expert group, do you all have anything else that you would like to add based upon the questions that have been asked and anything that you want to respond to each other at this point?
I think it's really important to meet your patient where they're at. I know we all said this. and that very small steps do matter. They really do matter. They give the patient confidence. They feel like they can do it. They feel more empowered to try something new, like a new recipe. They hear maybe other patients, and they're like, oh, I'm going to try and do that. That patient did something new. Really, really looking at those small steps, because they do matter, and they do add up.
Thank you. Okay, so now I would like to call upon the audience, if you have any questions for any of our folks up here today, anything about, sleep hygiene, diet, patients monitoring themselves, exercise, anything that that is of interest to you.
Hi, thanks so much for coming today. It was great. My name is Sarah. I work in the ER here at Downstate. I was actually talking to Linda, who trained me when I was on orientation a few years ago. But I was talking with her, and I was saying, I'm coming to this event, and it's, I feel like it's really nice information about lifestyle changes, and like plant-based health and all that stuff. But a lot of the patients that come in, I see DKA all the time. This is like the extreme of diabetes. And if I'm starting to talk to these patients about plant-based health, like a lot of them are just, they're sitting in the hospital bed ordering fried chicken. So for me to start talking to them about plant-based health, they're gonna laugh in my face, right? So I was just talking with Linda, like how, for these kind of extreme patients that maybe like, I don't know, like a lot of them seem like they're not really willing to, take ownership of their health at that point. Like, what are some tips that you might give to someone in my position to help them get? Obviously, they're not going to be, eating a fully plant-based diet the next day, but maybe to start, baby steps to get them to that point. And also, my manager asked me to, like, when I come back to work for my shift, to some takeaway points for my colleagues. Do you have any, maybe like, elevator pitches or something for me that I can give to my colleagues?
So maybe just to start, like it's a hard question, right? You want to talk, like, we're excited about something. We have somebody who's before us who maybe like that's not the right space for them to talk about things. And I'll just tell you one thing that I've learned in our lifestyle medicine program, and some of my colleagues may have found the same. I'm seeing some patients who I've been taking care of for up to 10 years in my own primary care practice. And as part of kind of our questions, like we ask what people like to eat, again, like, wow, amazing. What's your favorite fruit, or what's your favorite vegetable? We're also asking them questions about food insecurity. So are there ever times, when you've bought food and it's run out and you were worried that you didn't have enough money to buy more? And I have found more patients who I thought I really knew answer positively to that screening question, and it's really opened kind of a window into my own practice that I need to be more aware. So like getting to the root cause of why is it that somebody might be choosing some options for food rather than others, because of, I think, access is a huge challenge. So that's something that, like, getting to the bottom of it, and then maybe trying to connect folks to a community health worker, to maybe somebody's eligible for SNAP benefits. And so once they can get that, would that enable them to be able to put a salad on their plate once a week? Like, that could be huge.
And I'll just add to this as well, nurse to nurse, DKA. We know why someone goes into DKA, they didn't take insulin. Well, why? Could they not afford? We know there's been a lot of marketing and news around affordability of insulin for many years now. So is it that they can't afford their medication? We always assume, they're not compliant, which I don't like. We're not allowed to use that word anymore. They're not adherent. No, they're not aware of what maybe they should do. I always tell them, my patients are not compliant. It's not that they're not compliant, not adherent. They haven't been educated. And give me an opportunity to help them, to speak to them. So looking at what caused the DKA, maybe that's not the appropriate time to talk about switching from fried chicken to plant-based. It might not. I'm going to say it most likely is not, but you might get there. And on that note, I mean, I remember, being so passionate about plant-based and talking to a bunch of new parents, moms and dads. Healthy kids have happy futures, what I called my lecture. And I went on about how we want to raise this healthy generation. One person raised a hand. She said, I have a very limited income. I'm a mom of 3 children, single mom, and I can buy 5 boxes of macaroni and cheese for $1. And I had to think of a comeback. So I wasn't prepared for that. My comeback was at the time, don't laugh. Like, well, don't add the chemical cheese part of it. Maybe just the pasta with some plant-based margarine. And at least you're using it, but it's challenging. We don't have the answers to every situation that's going to come up, but meeting the patient where they are and just getting to the root cause of what caused that DKA. Could we help in some way?
Yeah, to add to that, so something that is super important is listening to the patient and also having an approach of like being very compassionate. As everyone is saying, it's just like, we don't know what's happening, right? So we have to respect their dietary needs that they have. So what are they choosing those foods? So sometimes it's not about, and this is something that we always disclose to the patients, you guys are in control of the process. We are here just to give you some guidance. So, and we're going to cheer you up, but you have to do the work, right? So, and some of the patients are very receptive. Some of them, they're like, you know what, I'm just interested on these pillars of health. I'm not ready for doing any nutrition changes. And also try to always explain to your patients that this is not something that is happening at them. This is not so always explaining a little bit of what's the process behind it? What is this happening? What is causing the disease, right? So I think that empowers a lot of the patients because oh, saturated fat. Oh, I never thought about eating fiber before, oh, what is this macronutrients or vitamins and why do I need them? So I think that it's having respect for the patient always is something that is going to empower them and is going to so something I would tell them, who likes to be told what to do? No one likes to be told what to do. When they understand, what are they putting into their bodies, when they understand and they can make the choices, if it's possible, because some of them, as everyone was saying, right? So they might not have the means of that. They might rely on food pantries. And when sometimes they come to us and they tell us, you know what, I want to take, I don't know, for example, I want to use plant-based milk, but in my pantry, they only give me cow's milk, right? So it's okay, so let's work with what you have. What do you have at home? Always be curious about that. So every little single step that we can help them to be more plan forward. So even if it's not going to be perfect, but it's going to be something that long term is going to help them to get into those goals to reduce their A1C or have a better lipid profile. So I don't know if you guys want to add anything.
There are some, Plant Power Metro has a lot of resources and ACLM that Beth Frades was talking about. You could just kind of slip a flyer into their paperwork.
Okay, next question.
Hi, everyone. My name is Mihir. I'm here with my dad, and my dad and mom both got diagnosed with prediabetes recently, so we're working on preventing that from changing to diabetes type 2. One thing I just wanted to echo the small steps that you mentioned. I think it's super powerful. There's this book by Dr. B.J. Fogg from the Stanford Behavioral Sciences Lab called Tiny Habits. It was actually recommended to me by Dr. Lori Marbus of Plant-Based Telehealth. She shared it with me. She uses it with her patients. Really, really powerful book for building habits. But my question, so it's about this 10,000 steps a day has become really popular. And I have a suspicion, I'm going to pick on my dad, he gets 10,000 steps every day, but I don't know if he's getting the cardiovascular benefit of that exercise. So I wanted to understand how to actually get that cardiovascular benefit and anything specifically related to getting the blood glucose benefit as well from exercise versus maybe he walks around a lot while he's on the phone, gets steps in, but I don't know if the heart rate is getting into that higher zone. Thank you.
So I mean, I think that there are different types of physical activity, and I always say, like, any kind of movement is great, okay? So walking, it's never just walking, but walking is a wonderful thing. Then there's the next step to try to get to that moderate level where you're really trying to get your heart rate up. And so I'll tell my patients, I still want you to be able to talk to the person who's next to you, but you should get sweaty. Your heart should be going. And that's really the level that the studies have looked at in terms of exercise and diabetes, where you're trying to reach 30 minutes, most days of the week, so 5 times a week for moderate intensity exercise. And you can do a little bit less than that if you're doing vigorous exercise. But the vigorous exercisers out there, are not as frequent as the moderates. But really trying to talk about that, because I also have many patients who tell me, but I'm moving, I'm walking, I work, I'm an electrician, I'm carrying stuff, I'm going up ladders. Like, they are moving. They're not in that sedentary category, but they get to add more. And so they get to do it by running to the train, just like you said earlier today, right? So getting off that bus 2 stops early, and just kind of, working a little harder to get there and pumping their arms, moving. And so I feel like that's definitely a step. So part of the physical activity prescription for primary care, it's the frequency, and it's also the intensity that you're trying to look at the time.
I'd like to piggyback on that.
Yeah.
So there is a difference between daily movement. It sounds like your dad's doing a lot of daily movement. That's great for general health. And then there's aerobic exercise, and there's strength exercise, and there's balance exercise. So it's, what is he willing to do? Is he comfortable at daily movement level, and you want to increase that daily movement? So he's moving a tremendous amount, but he's a little apprehensive about exertion. A lot of people who haven't exercised feel uncomfortable with exertion. So where does he feel comfortable? Does he feel comfortable riding a bike or a stationary bike? Maybe he would feel a little more comfortable exerting himself a little more on a bike, or anything that he likes, and it could be for 30 seconds. So maybe just increase his exertion for 30 seconds, whatever that is for him. So not really, it's more of his own perceived exertion, right? Am I working harder than I was before? Is this a little harder than just a walk? Maybe he does that for 30 seconds in his walk. Maybe his walk's a little faster for 30 seconds or 10 seconds, and he goes back to his normal pace. Any kind of lift of a little more exertion will start to move him out of that daily movement and start to move him near that aerobic capacity, or even strength training, even doing something completely different. If he's not doing any strength training, that would be really good with bands at home or at gym. Really start to diversify the type of activity he's doing, and that would be super helpful too, because the combined aerobic and strength training for diabetes is tremendous.
And from the physical therapy standpoint, a person needs to do what's called progressive resistive exercise. So if you walk the same distance every day, bicycle the same route every day, you get better, but then you plateau. So if he can walk with you or another young family member, and and just have him walk fast for a block and then slow down, so that's called interval training. He could also try going up and down a flight of stairs. If you live in an apartment building, go up a flight of stairs. Or if you have a house with stairs. And go with him the first time if he doesn't normally do stairs. In apartment buildings, sometimes you can just do elevators and never do stairs. So that's also another good way, in addition to, certainly the gym, the exercise bands, weights. And in older individuals, they really need to work on strengthening of all the leg muscles, because that's what's going to prevent them from losing their balance, falling, and fracturing.
Increased
Can I
quality
just
of
add
life.
one thing to that also, too? When we're teaching about physical activity in our classes, and we'll say, what is the most powerful medication, but yet most underused in either prediabetes or diabetes? And patients will usually say, oh, she must be thinking about insulin. It's physical activity. It's the strongest medication, but yet mostly underused. So using that, but again, it's that biofeedback, getting that, looking at a sensor, looking at a blood glucose meter, and in pre-diabetes, this summer, because pre-diabetes, you're not going to be covered for a continuous glucose monitor, but this summer there'll be an over-the-counter one. So anyone will have access to a continuous glucose monitor. And you can go for that, be busy during the day, but then what I call walk with purpose, seeing the difference between what your blood sugar does with being active, but then walking with purpose. And we also teach too, when I'm doing exercise classes, well, not exercise classes, but teaching about exercise, I'll have like a top or a dreidel, and I'll spin it, and I'll be dancing, and then I stop, and everyone will see the dreidels going. That's the impact of physical activity. By doing that, you've engaged your metabolism long after you stopped, and that leaves them with such an impression that they want to then do it, because they can visually see it.
Thank you.
And we need to wrap this up now, but I just had one other thought. The other thing that physical therapists do with patients with diabetes, if they're going to walk long distances, we want to make sure that their footwear is very comfortable, and you want to do a skin check of the feet to make sure that there's no rubbing of the skin, because that's something that's very important as well. So I want to thank you, panelists. This was very interesting, and thank you for the members of the audience who asked interesting questions that continued our conversation.
Thank you.
Thank you.